Time now for Your Health, a presentation of Medica Pharmacy with 2 locations, of course, here in Bardstown on 4th and Stephen Foster, and in Shepherdsville. And in studio with us today on this pre-recorded show is Alyson Schwartz. And good day, Alyson.
Good day to you.
Well, today we are talking about this as Breastfeeding Awareness either week or month, but we're going to talk about the importance of that motherly action.
Exactly. It has many, many benefits, socially, economically, and health benefits for sure. So I just wanted to kind of touch base on all of those benefits for all involved, mother and child.
And even for mothers that return back to work, as many of them may do, very quickly after giving birth, there's lots of devices and ways they can be a breastfeeder and even return to work.
Oh, exactly. If you're going to try to continue to breastfeed when you go back to work, you can use the breast pumps. Mm-hmm. One important thing to know about those is if you are not using a hospital-grade breast pump, you do not want to get a used one. So if you're buying one of the inexpensive ones from, Babies R Us or Target or wherever, you need to purchase a brand new one. Otherwise, rent the hospital-grade ones. There's no risk of contamination with those. Nothing crosses through that machine like it does in the lesser expensive model. So the hospital grade ones are phenomenal, and I definitely recommend renting those. There are 2 places here in town that you can get them. Medica Pharmacy is one of them, so we do rent those for anybody that wants to go back to work. And hopefully you have a workplace that allows you time to go and pump. I know we have had a couple of girls that work for us that have wanted to continue to breastfeed, and so we allow them the multiple breaks of the day to go into a closed office and pump their breast milk. So hopefully most of the workplaces in our area will allow women to do that.
And we're finding it to be a more friendlier, I call it atmosphere, but workplaces and other things to accommodate breastfeeding.
Yes, we are. And I mean, if you really look at the benefits of breastfeeding financially, then you would think people would definitely encourage the women to breastfeed. I just read that the U.S. government spends $578 million per year funding breast milk supplements like formula through the WIC program. So, I mean, you think of the recession and the economic troubles that this country is in, I think, well, if you could convert a vast majority of those women to breastfeed their babies, everybody's going to save a lot of money. And if you happen to be paying for formula, it says you're on average going to spend $1,200 a year for formula. And if you breastfed, then you might spend $300 in the extra food that the mother's going to have to eat to maintain the higher calorie count it takes to produce the breast milk. Well, that's $900 savings. And I mean, who couldn't use an extra $900 in their pocket at the end of the year?
Well, let's switch over to the benefits of it for the baby.
Okay, so it's we all say you get your top antibodies from breast milk. So we always say they're healthier and have a better immune system. But what's interesting is breastfed children actually score higher on cognitive and IQ tests at school age and have better visual acuity. They have lower incidence of the sudden infant death syndrome, or SIDS. They're less likely to suffer from infectious illnesses such as diarrhea, ear infections, and respiratory infections and meningitis because of the immune system being better. They have a lower risk of inflammatory bowel disease. That has to do with the fact that you get the good probiotics or the good bacteria that your intestines needs to be healthy from breast milk. So if you're not going to breastfeed, you definitely need to think about putting your child on a probiotic. Again, that's going to cost you extra money. So breastfeeding is going to give them that good bacteria to help cut down on inflammatory bowel disease like Crohn's disease and ulcerative colitis. They suffer from less forms of cancer. They have lower risks of children's onset diabetes or diabetes type 1. And if they have a family history of diabetes, they're actually at a lower risk for the onset of type 2. They have lower risks of asthma and eczema. The eczema part has to do with the good bacteria, and asthma does too a little bit. If you have a good intestinal tract, then you have less risk of allergies and asthma, but definitely of the eczema. And they have lower risks of childhood obesity. That's huge in this day and age. If you can breastfeed your child to help kind of cut back on the obesity epidemic, definitely take advantage of that. They have fewer cavities, and I'm assuming that maybe there's some extra sugars in the formulas that maybe has something to do with that. Not 100% sure. Then you always have the premature infants, and this one's where it gets tricky because sometimes the premature infants are in the hospital, so it is tougher for a mom to breastfeed, which is definitely what you want to recommend. Try to breastfeed them if they can. pump the milk if you can't, because it actually says it significantly shortens the length of the hospital stay, reduces hospital costs, helps their brain stem to mature quicker, and reduces the life-threatening illnesses in the digestive tract and other diseases that affect the premature babies. Sorry, I got tongue-tied there. The other thing it affects is the mothers. When anybody that's had a baby knows that you have a very long term of postpartum bleeding. Mm-hmm. When you breastfeed, you produce the oxytocin that causes your uterus to contract and get everything back in line, so you actually have less bleeding. It shortens the bleeding span after you've had a baby. But one of the big ones is you're much less likely to have ovarian cancer or the breast cancers. So that's definitely a benefit if you're going to breastfeed. It reduces osteoporosis. And you typically lose weight quicker because you're burning off so many calories. Your uterus is stretched out, which is part of where that, kind of bigger belly comes from. So when you start shrinking up that uterus from breastfeeding and burning off all those extra calories, you're going to return to your pre-pregnancy weight. And some women, if they're a little bit overweight, if they breastfeed, actually will be less in weight after they're breastfeeding than they were even before they got pregnant. So, great diet plan maybe, breastfeeding sounds good to me. And it can reduce the anemia that you may have. A lot of women are anemic after babies because of all the blood loss. So if you can shorten the blood loss by breastfeeding, you're going to have less risks of anemia.
Well, when you go through all of those things, I have to ask, why do women, again, easy for me to ask, but why do women choose not to, in your opinion?
I guess from my personal experience, in the beginning, it's, breastfeeding's natural, it should be easy. But it's not always easy. I mean, it is tough, and there is some pain involved, and, trying to get that infant to latch on. You have some sore nipples. Some women actually get infections because maybe their child gets a yeast infection in their mouth, and then the woman gets an infection in their breast. But it's not easy, and so you're uncomfortable. You will leak out breast milk. When milk starts coming in, you are very sore and very tender. But it's a learning curve, and so I know that for me, it's about 2.5, 3 weeks, just when I thought, my goodness, is this really worth it, that all of a sudden it got really easy. And so, yes, it is. They say, it's easier. You don't have to work to breastfeed. It's easier to go fix a bottle of formula. I'm contrary to that. I'm like, if your baby wakes up and, every 2 to 3 hours when they're an infant, do you really want to have to go down and fix a bottle of formula when you have food right there if you would just utilize it? I mean, I was notorious for going and getting my little one and laying in the bed, letting him latch on to start breastfeeding, and I'd go back to sleep so, I mean, people always joked about how I seem so rested, and I'm like, I go to sleep when he sleeps, and while he's eating, I'm dozing in the bed. So I felt like I got plenty of sleep in those first few days, but to me, everywhere you go, you have food. And I didn't have to go and spend that huge amount of money on formulas. And, I was very fortunate, all the decreased risks of infections. I don't think my little one had his first ear infection until he was almost 3. Mm-hmm. And for that first, 2 years of his life, I don't think he went to the doctor once for being sick. And I lost my weight very quickly and felt great, and he did great. And, that's the way babies are designed to eat. And, you've heard me talk about adult diets that we're not designed to eat boxed and packaged stuff. Well, formula is a packaged food. And, yes, it can mimic the breast milk, but you can't, no matter how close you try to make it, you cannot make formula as good for you as breast milk is. That's the way we're designed to eat when we're little.
Is there something about the fact that this child has got the same DNA as mom, and so all these immunities, all these things that you've talked about, all these benefits? Is that? It seems like nobody would want to passing those along to their children.
Oh, exactly. And it's a huge benefit that shows when you start breastfeeding immediately that you convey all those antibodies and different parts of your immune system to the baby. And the longer that you can breastfeed, the better. And studies show that most women stop after 3 or 4 weeks. When if you can, ideally, you would breastfeed exclusively for 6 months and then start to introduce solid foods and then, rotate them into regular foods as they start to turn a year. There are certain foods that they don't want you to give a child before they're a year old. Peanut butter, they say oranges, eggs, anything that maybe is an allergenic food product, you want to wait till they're a year old. But the brain develops so much better from breast milk than it does from formula, just from all of the different things in breast milk and all the nutrients it supplies that you don't necessarily get from formula, no matter how well you try to mimic it.
Now, one thing that I may have picked up on is we need to have a healthy mother to do this for lots of reasons, because the female body has to work a little bit to produce that milk.
It does, and so the one thing when breastfeeding is you have to drink water. And so I know I always would have a glass of water beside me anytime I was breastfeeding, because you get dehydrated very, very quickly. Well, breast milk is part water, so if you're dehydrated, you're going to have trouble producing milk, and certain foods and certain substances can dry up breast milk, and so you want to make sure that you're giving yourself a balanced diet. Even if you're not giving yourself a balanced diet, breast milk is still better for that baby than formula, but the healthier that you can eat, the better you're going to feel, the better quality and the more amount of breast milk you're going to produce, that you can keep that baby fed. And I will say certain foods affect babies. I know I learned the hard way because I didn't drink coffee except on Sundays, and I could never figure out why my child seemed to be fussy and didn't want to sleep on Sundays. And after the third Sunday, I went, I'm drinking coffee Sunday mornings. And so, they do get a little bit of that caffeine. So, there are certain things that you may eat or drink that will affect the child, but if you're eating that balanced diet, then your child's definitely going to benefit from that.
Does a mother need to, on medications prior to having a baby, how much passes through the mom to the child? I know you don't, no alcohol, no smoking, but what about normal medications or anything else that a mother might take?
There are lots of medications that you should not take if you're breastfeeding. And so there are some that are perfectly safe. And so always, definitely call the pharmacy. That's something that if we don't know off the top of our head, it takes us just a couple of minutes to look it up to see any recommendations on it. Talk to your OBGYN or your lactation specialist. They may have that list. As far as drinking alcohol, a glass of wine is not a big deal. But it's also, if you maybe have a babysitter one night and you go out and you have a few drinks, hopefully maybe you've pumped some milk before you went out and you have some in the freezer or the fridge, and then you can pump that milk from where you drank and just get rid of it. I know I didn't drink enough to not breastfeed, but if you do go out for a night of drinking, just pump that off and dispose of it and then continue on with breastfeeding.
Because I know that in our family, there's always seemed to have been adequate supplies in storage ready when mom wanted to take out.
Oh yeah, you can buy the storage bags to keep it in the freezer. We sell those at our pharmacy, and and that way, if you have a babysitter or something easy, you just take your already pumped milk with you and you give it to the babysitter, and all they have to do is thaw it out and give it to the baby. And the one thing about if you want to be successful with breastfeeding is in that very beginning, you don't want to give that baby a pacifier, and you don't want to give them a bottle until they're really good at latching on, because the way they latch on to a pacifier or the nipple of a bottle, it's a much smaller area, and so then they don't learn to latch on properly, so then you're never going to get past that uncomfortableness of breastfeeding. So and what helped with my little one is that I didn't use a pacifier at all until he was probably a little over a month old, not for bedtime, not for anything, and so he never really had to use a pacifier. And so he used one at night sometimes, but by the time he was 13 months old, we had no pacifiers at all in our house, and no temper tantrums, no trouble sleeping, but it did seem to decrease the need for him to need a pacifier. And so hopefully that's an incentive there. If you don't have to worry about how am I going to wean this child off a pacifier, just don't give him one in the beginning. I feel like it makes you have better soothing abilities with your child to kind of calm them down without having to use a device, and then they are better for it in the long run. Not that there's anything wrong with pacifiers, but it does make it harder to get them really good at breastfeeding.
They make some cool ones today.
I know they do, but and you got to be careful with them, because some of them increase cavities and some of them can change. I know they make them a lot better now, but ask some of the dentists out there what long-term pacifier use does to that child's mouth and the way that they bite and the way the teeth grow in, and it's not good. So, and something interesting about breastfeeding is, the mayor of New York got in all kinds of uproar about disallowing soft drinks. Well, he actually is encouraging all the hospitals in New York to keep their formula locked up, to encourage all the mothers to breastfeed and only give formula if the mother is really having difficulty breastfeeding. And if you look at the benefits of breastfeeding and the cost savings, if anybody's having economic difficulty, it ought to be a no-brainer to breastfeed. Even if you are on one of the programs through the government that helps you to purchase food, if you can use those food stamps or whatever whatever kind of money you're getting from the government, if you can use it on food for your family as opposed to having to waste it on formula, then you're still saving money, and you're letting that monetary funds that you have go farther. So yeah, he's keeping everything locked up and trying to encourage breastfeeding in New York. So we'll see how that goes.
It's Mayor Bloomberg, is it?
I think I think yep, that's Bloomberg. Yeah, he just did this. So a lot of people are supporting it, and of course then there's. I'm not necessarily a fan of that any government agency should tell you how to live your life with that way, but with the benefits of breastfeeding for moms and babies and for the pocketbook, I do think it's a good incentive to encourage it, because we got away from that when formulas came out. And, if you remember way back when, you didn't have a whole lot of options. That was the only thing. And I think we've kind of gotten so used to formula feedings that we tend to forget how much better breast milk is for our babies.
And all the support that's out there, as you mentioned, the lactation specialists. I'm not sure they were around when my kids were born, but I do know that with both my grandkids, that they have been. I don't know that I met them, but I know I had to leave the room when they were coming in.
Oh, yeah. Well, and the lactation specialist wasn't at Flagey. I delivered at Flagey, and she wasn't there. I never actually met with her. But the nurses at Flagey were wonderful, and they knew what they were doing enough to help you out. And I couldn't have asked for better nurses and better care than I got when I delivered out at Flagey.
Yeah. Well, again, being breastfeeding awareness time of the year, we have heard so many reasons why to do breastfeeding, and I don't know why a woman wouldn't, but again, it is a personal choice, as we always say these days.
It is. It is definitely a choice. But, if you look at the benefits of it and the cost savings of it, it's definitely something to at least consider. Give it a try. And, like I said, give it at least 4 weeks, because, for most women, it takes 2 or 3 weeks before all of a sudden it gets really easy and really comfortable. And I know I was not ashamed to, go sit in the corner booth at a Panera Bread or wherever we might have been out and breastfeed. Bring your, blanket to cover up or whatever. And I don't think I ever had anybody give me a strange look. And maybe there are those people out there, but it's your right to do that. And if you prefer to try to do it in a private place, that's fine. But, I just popped myself in a corner somewhere where I wasn't real visible. But it's just so easy to always have that food supply there. So it's definitely something to consider and give it a try, and give it that 3 or 4 weeks and try to get really good at it. And you'll realize how much easier it is to just be able to grab that baby and feed them instead of having to run down, get the formula, mix it up, and then by then you're wide awake, and then you have trouble going back to sleep.
Well, Alyson, what else is going on at Medica Pharmacy? As we're heading, I guess, close to another anniversary. I know you've passed 30 and you're moving forward, but anniversary is not yours.
I'm only 29. I have no idea what you're talking about. It is our 32nd anniversary, so we will be having a customer appreciation the 1st of September. I'll have some more details for that coming up, and I'm sure we'll have some information on our Facebook page. So, look to that for any information on what we're going to be doing. It's also right around the corner from flu shot time. Mm-hmm. We are this year going to be offering a homeopathic option for anyone who does not want to do a flu vaccine, or if you cannot do a flu vaccine, if you're one of those egg allergic people and you cannot do the flu vaccine, we're going to have some options for you. It's a homeopathic remedy that you do 1 milliliter a month, every month from the start of flu season through the end of it. I have a couple of pharmacies I know that have been using that for a while, and knock on wood, they're telling me that in the past 7 years of using it, not one of their staff members has gotten the flu by using this remedy. So it's an option to the flu shot. We're going to do our drive-through flu clinic. It is Immunization Awareness Month, so I'm going to be talking a little bit more about shingles vaccines and the pertussis or whooping cough, which we're starting to see a huge resurgence in our area, as well as some other states. So I'll be talking a little bit more about some vaccines on our next show.
All right. Thank you very much. And it's also back to school time, so keep those kids healthy and make sure they've got plenty of everything they need.
It is, yeah. If you need some immune boosters, probiotics, or vitamins, definitely come talk to us. And there's definitely some ways to help protect your children from the upcoming sure-to-have cough and cold, runny noses now that they're back in school.
You ran that all together so perfectly.
I know, yeah. It all fits together all the time. Back to school, runny nose, cough, sneezy. Yep, that's how it happens.
Thank you very much, Alyson, for coming in. Alyson Schwartz, Medica Pharmacy, for your health, and we'll see you in a couple of weeks.
Sounds great. Look forward to it.